Welcome to the deep dive. This is where we take really detailed operational documents, like business plans, strategic models, that sort of thing, and we break them down into what really matters.
Right. The goal is to give you the shortcut to understanding what's actually making a difference in some pretty complex industries.
And today we are doing a really deep immersion into a sector that is, I think, often overlooked, but is absolutely critical to healthcare.
It really is. We're talking about non-emergency medical transportation, or NEMT.
Exactly. And our source material for this is the full business plan for a company called SwiftAid Transport, LLC. They're based up in Orange County, New York.
And what's so interesting here is that NEMT is usually seen as just logistics, a car service. But this business plan frames it as a massive point of failure in the patient care journey.
It does. So our mission for this deep dive is to really dissect the SwiftAid model. We want to understand how they plan to translate these promises on paper, things like reliability, dignity, accountability, into actual real-world trust.
Trust for both sides of the coin, right?
Right, for the big institutional clients like a hospital, but also for the individual, the private pay patient who just needs a safe ride home.
And that's the core of it. NEMT is, by its nature, a high-friction environment. When that ride is late or it doesn't show up, the effects just ripple outwards.
Oh, immediately.
Yeah, you get patient stress, you get missed appointments, and you get just profound operational chaos for the healthcare facilities themselves.
So SwiftAid is positioning itself as the solution.
They are. They're trying to prove that you can fuse highly predictable, safe logistics with a genuinely human-centered approach to care. The idea is that consistency and compassion shouldn't be mutually exclusive. They really can coexist.
All right, so every good business plan, every good idea, really, it starts with a clear problem that's worth solving.
Absolutely.
And when you get into this section of the SwiftAid document, it is immediately obvious that this isn't about, a minor inconvenience of waiting a few extra minutes. This is a critical breakdown.
Yeah.
What did they identify as the real crux of the problem?
Well, the core issue they point to isn't just that a ride is late. It's the combination of the delay itself and this crippling uncertainty that comes with it.
The not knowing.
The not knowing is the killer. The plan says that patients in their service area, Orange County, are routinely waiting for long, frustrating periods, sometimes hours, just waiting for a ride home after a medical appointment.
Hours.
Yeah, hours. And you have to put yourself in their shoes for a second. Imagine you're medically vulnerable, you've just been discharged from a procedure, maybe you're feeling a bit groggy or in pain,
Yeah.
and you're just left sitting in a waiting area with absolutely no clear communication about when or even if your ride is going to show up. It creates this acute instability right at the moment a patient needs stability the most.
And that wait time, it's not benign, is it? It's not just boring. It has real consequences.
Oh, absolutely not.
I want to stick with that ripple effect for a minute because the source material is really clear that it hits two very different targets, the individual patient and then the much larger healthcare system. Let's start with the patient.
Okay, so for the patient, the consequence is immediate and it's frankly clinical. It leads to this profound stress and anxiety. And this is especially true for the most vulnerable groups, seniors, people with disabilities, or someone with a chronic condition like kidney failure who absolutely depends on that transport to get to and from dialysis.
That anxiety can't be good for their health.
It's not. It can actually exacerbate their existing health conditions. Think about blood pressure, stress hormones. But beyond that, there's a practical problem. If a patient is discharged hours late, or if their ride to an appointment was a no-show, it often means they miss crucial follow-up appointments.
Ah, so it breaks the chain of care.
It completely undermines the entire continuity of care that the doctor prescribed. The whole treatment plan can get derailed because of a simple logistical failure.
It's fundamentally a question of dignity at that point, isn't it?
100%.
You've gone through this medical procedure, you've received the care, and now the very last step, the simple act of getting home, just strips away that sense of safety and respect.
That's a perfect way to put it. When you're discharged from a medical facility, you are inherently vulnerable. You're physically weak, maybe emotionally drained. And being left stranded like that, it just erodes all the trust.
Not just in the transportation company, I'd imagine.
And that's the key. It erodes trust in the hospital or the clinic that contracted them. SwiftAid sees that waiting period as the precise moment the entire patient experience can just fall apart.
Okay, so that's the human cost.
Oh, okay.
But the business plan also talks about a huge operational disruption for the facilities themselves, hospitals, clinics, nursing homes. How does unreliable NEMT hit their bottom line and their day-to-day work?
This is where the systemic cost becomes just Undeniable. Unreliable NEMT directly causes delayed discharges.
Okay, unpack that. What does a delayed discharge actually mean for a hospital?
It means chaos for their throughput. Think about it. A hospital bed is a valuable, limited resource. It can't be turned over, cleaned, and prepped for the next patient if the current patient is still sitting in it, waiting for a ride that should have arrived 2 hours ago.
So it creates a bottleneck.
A massive one. This inefficiency stalls patient flow throughout the entire building. It compromises the quality of care for everyone, and it just wastes incredibly valuable resources.
And I imagine it pulls staff away from their actual jobs.
It does. The plan points out that hospital staff nurses, administrators, end up spending critical time on the phone, constantly calling and checking on the status of a ride.
Time that should be spent on patient care.
Exactly. Time that should be devoted to clinical duties or other essential administrative tasks. It's literally pulling nurses away from the bedside to become logistics coordinators. It's an incredible waste.
So the facilities are essentially paying for this bad service twice.
They are. Once for the actual service fee, and then again through lost staff time, reduced efficiency, and lower patient satisfaction scores.
The problems detailed in the source, though, they go deeper than just being late.
Sure.
The plan identifies some common, more structural failures in the existing NEMT world that SwiftAid says it's trying to fix.
Yeah, they're failures of accountability and, I think, transparency. The most obvious failures are, of course, the late arrivals and the flat-out missed pickups. But the more corrosive issues are systemic.
As such as?
First, just poor and inconsistent communication. The dispatcher isn't talking clearly to the driver isn't communicating with the facility staff, and the patient or their family is completely in the dark. Nobody knows what's going on.
Okay.
Second is a real inconsistency in driver professionalism. You might get a fantastic, caring driver one day, and the next day you get someone who's unprofessional, maybe not properly trained, who makes the patient feel uncomfortable or unsafe.
And you mentioned transparency before. The biggest issue there, I'd guess, is the lack of real-time tracking, that feeling of being in the dark.
That lack of visibility is the silent killer of trust in this business. If you're a facility administrator and you call the provider and they tell you, oh, the car is 5 minutes away, but you have no way to verify that claim.
It's an empty promise.
It's completely meaningless. The uncertainty remains, and your staff still has to wait with that patient. The trust is already broken.
I also noticed the business plan is very direct in flagging concerns about fraud. This isn't just something they're guessing at. It's a major known problem in the NEMT industry.
It is a massive issue, and it directly erodes trust across the entire sector. The plan explicitly calls out unverified trip logs that lead to huge billing discrepancies and disputes. This is especially true with high-volume payers like Medicaid.
So trips that are billed but maybe never happen.
Or the times are logged inaccurately, or the mileage is padded. This kind of fraud diverts critical public funds away from patient care and forces regulatory bodies to become much more strict and intrusive for everyone, even the good actors.
And for a hospital, that's a huge liability.
It's a nightmare. If a facility can't trust the billing records from their vendor, if they even suspect that trips were billed but not completed, they simply cannot trust that provider. Accountability for the dollar is, in this case, completely linked to accountability for the patient.
Okay, so that paints a very clear and frankly pretty bleak picture of the crisis that SwiftAid is trying to step into. The plan then frames its core mission around closing this critical trust gap. How do they articulate their solution, what they call the dignified solution, to this systemic mess?
Their solution is very consciously dual-focused. It's designed to address both the facility's needs and the patient's needs at the same time.
Okay, break that down.
For the facilities, the #1 goal is reducing that operational friction we talked about. They aim to do that by restoring predictability and transparency, mostly through using superior systems and technology.
And for the patients?
For the patients, the commitment is to provide a dignified, reliable experience. They label it human-centered care. The ultimate mission, as they state it in the plan, is to ensure every single client, whether it's a private pay senior or a hospital discharge, gets home safely, promptly, and with unwavering confidence in the integrity and compassion of their transportation provider.
So they're selling competence and character in equal measure.
That's it, exactly. They're trying to prove you need both to fix the problem.
So if the problem is a failure of systems and a failure of compassion, then the solution has to be built into the very structure of the company. Before we get into the tech, which is fascinating, I want to stay on the leadership philosophy for a moment.
Good idea.
Because the plan gives a lot of detail about the founder, Jamel Holder and her approach.
Yeah, the leadership structure is really the first proof point of their entire commitment. Jamel Holder is the owner and the operator, and she does not come from a typical logistics or transportation management background. Not at all.
Right. Her background is in social work.
Deeply rooted in social work and community service. The plan lists her prior roles: preventive case manager, home finding specialist, recreation specialist.
That is fascinating because she's not bringing the traditional, move the boxes from A to B operational mindset. She's bringing a high-touch, client support, trauma-informed lens to a logistics problem.
Exactly. And the training listed in the plan shows this foundation very clearly.
What specifically did you see?
Her certifications are comprehensive: social work, APA, OSHA, CPR, and mandated reporting. These immediately signal a completely different set of priorities. Her career was spent coordinating complex services, mental health, educational, medical, and often physically escorting vulnerable families to those appointments.
So she's seen this breakdown firsthand.
Many times. This experience means her foundational ethos is built on empathy and dignity. The commitment to a trauma-informed, ethical approach underpins the entire service. The accountability in their model starts not with the software, but with the human ethos of the person running the company.
And yet there's this strategic counterbalance in the advisory role. Donald Holder,
Right.
who brings 17 years of experience as an NYPD sergeant. Now, doesn't that blend of social work and police operational discipline, doesn't that introduce some potential friction? Does empathy sometimes clash with the need for rigid operational control?
That is a critical question, and it's one I thought about too, but the plan suggests it's not friction, it's synergy. Well, the NEMT industry really requires both compassion and control. Jamel brings the social work empathy, the community perspective. She understands the acute vulnerability of the passenger.
Okay.
Donald, on the other hand, brings high-level operational discipline, accountability, security protocols, and deep experience in operational management. The combination basically says, we understand the nuanced human need, and we have the stringent, reliable system needed to guarantee consistency and security.
So it's the heart and the head.
It's the perfect marriage of skills to address an industry where, frankly, chaos and a lack of compassion often dominate.
Okay, so here's where it gets really interesting for me. How do you translate that dual philosophy into an actual service? SwiftAid uses this phrase, care in motion, and emphasizes a systems-first approach that's supported by tech.
Yes.
This suggests they see NEMT not just as a ride, but as a kind of high-tech healthcare extension, like the ride itself is a piece of medical infrastructure.
I think that's absolutely right. For them, technology is not just an add-on or a nice-to-have. It is the engine that is designed to deliver transparency and reliability.
Which are the foundations of trust.
The absolute foundations of trust in a sector that is just plagued by poor communication and, as we discussed, unverified claims. The business plan details this core technology stack that's engineered to bake accountability into every single stage of the trip. It's designed to replace human error with integrated intelligent systems.
Okay, let's break down that stack. Let's start with the central nervous system of the company, their business operations platform.
They use the Zoho ecosystem for that.
Yeah.
You can think of Zoho as the single source of truth for all of their business functions: CRM for client management, HR administration, data storage, dispatch communication, all of it.
And why is that centralization so critical? Why not just use a bunch of different apps?
Because if the systems aren't centralized, things fall through the cracks. The HR system might not talk to the dispatch system. That could mean a driver gets assigned a really high-stakes trip without management being able to confirm that their CPR or high-PA certification is up to date.
I see, it's a risk management tool.
It's a huge risk management tool. Centralization ensures total consistency and seamless communication because every employee, every piece of data, every client interaction is managed within one single compliance system. It guarantees a professional experience and it protects them against major compliance risks.
Okay, so that's the back office. Now let's move to the road. They use a specialized NEMT platform called the Bambi Dispatch and Scheduling System. What can this do that, say, a standard Uber or taxi app couldn't provide?
Bambi is built specifically for the complexities of medical transport. It enables what they call smart trip management, so it gives them automated, optimized assignments based on real-time traffic and live vehicle locations. But the key function here is that Bambi acts as an intelligent buffer.
What do you mean by that? An intelligent buffer?
Because it's a specialized NEMT platform, it uses algorithms to mathematically prevent the staff from overbooking a single vehicle. or from stretching a driver's schedule beyond what is safe and predictable.
Ah, so it stops them from making promises they can't keep.
Precisely. Overbooking a van is the silent killer of NEMT reliability. It's the #1 cause of cascading delays and missed appointments. Bambi is designed to prevent that kind of operational self-sabotage. It ensures predictable scheduling and directly supports their ambitious 95% on-time target.
And then there's the final piece, which feels like the ultimate check on accountability and safety, the Motive AI dashcam system.
This is the big one.
It is, because compliance is a huge claim to make. How confident can a hospital be that a third-party AI system like Motive will actually hold up under a rigorous Medicaid audit, especially when so many other providers fail that test?
This is the non-negotiable component for building institutional trust. The Motive AI dashcam does two things. First, it provides real-time video monitoring and actively detects unsafe driving behaviors, speeding, distracted driving, harsh braking, which ensures passenger safety is being upheld moment to moment.
Okay, that's the safety piece.
But its real power, in the context of accountability, is that it functions as an independent evidence system.
An evidence system.
It offers verifiable, time-stamped, and geotagged trip documentation. For a facility or a payer like Medicaid, this data is irrefutable proof. If there's a dispute over a billed trip time or a potential fraudulent claim, the Motive system provides the exact route, the time spent at the pickup, the time at drop-off, and the driver's behavior throughout.
So it kills the ambiguity.
It completely transforms a suspicion of fraud into a certainty of verification. It protects the facility from getting caught up in a billing dispute caused by their own vendor.
So when you put it all together, Zoho for consistency, Bambi for the scheduling discipline, and Motive for the verifiable evidence, this integrated tech stack is designed to replace uncertainty with confidence.
Yes, and to deliver live trip updates and instant communication between everyone, the dispatchers, the drivers, the clients, and the facilities, everyone is on the same page.
And that constant visibility, that really is the cornerstone of the trust they're trying to build in this market.
It is. When a patient or a caregiver or a facility administrator knows exactly where that ride is, when it arrived, and when it will depart, the fundamental anxiety around logistics it evaporates. And operational efficiency soars. They're leveraging technology to build an inherently trustworthy framework.
Let's shift gears now and really focus on the institutional client base. We're talking about the hospitals, the nursing homes, the dialysis centers. These are the crucial clients that need high-volume, recurring transport.
The bread and butter of the business.
Exactly. So what does SwiftAid offer them that goes beyond just a reliable vehicle? The value proposition has to be about more than just a ride. It has to be about efficiency.
For these facilities, you're right. The value proposition is almost entirely focused on reducing that operational friction and enhancing their own patient care coordination process.
So they're trying to make the hospital's job easier.
Yes, they aim to seamlessly integrate into the facility's workflow by forging strategic partnerships. And what that means in practical day-to-day terms is dramatically shorter patient wait times and, most critically, reducing the administrative burden that comes with patient discharge delays.
You keep coming back to that phrase, operational friction. Can you give us a really concrete example? What is something a hospital staffer does 10 times a day now that they wouldn't have to do if they were working with a provider like SwiftAid?
That's an excellent way to frame it. Okay, so right now, a facility administrator or a nurse spends significant, repeated chunks of their day doing one task: chasing transportation updates.
Right, making phone calls.
Constantly. They call the NEMT provider, they wait on hold, they ask where the car is, they probably get a vague answer, and then they have to go back to the patient and their family and explain the delay. With SwiftAid, that task is nearly eliminated.
Because of the tech.
Because of the tech. The plan highlights that facilities get real-time visibility into the trip status. They can access it via a digital portal or get instant communications. This radically reduces the need for their staff to constantly be checking up.
And that saves real money.
It saves hours of labor every single week. It allows them to focus on clinical care, not logistics management. It's a huge value add.
And that reduction in overhead, it translates directly to cost savings and probably better patient satisfaction scores for the hospital itself.
No question.
Let's talk about the drivers again, because for a facility, that driver is basically an extension of their own patient care team for that brief period. What assurances does the business plan give about driver professionalism and consistency?
The plan guarantees professional drivers who are consistently uniformed, courteous, and highly trained. And the training goes way beyond just basic driving skills.
What does it cover?
It covers patient care, customer service, and rigorous compliance protocols. This insistence on patient sensitivity and dignity, which is a direct reflection of Jamel Holder's social work background, is designed to ensure that the handoff between the facility and the NEMT provider is calm and professional.
So the driver is trained to be more than just a driver.
The driver is trained to act as a sensitive caretaker during that transition, not just a chauffeur. That's a key part of the care in motion idea.
And crucially, that technology stack we dissected earlier that allows compliance and accountability to be built right into the service model itself.
Compliance is absolutely foundational to their pitch to institutions. They guarantee full HIPAA compliance, which is critical for patient data privacy, and OSHA compliance for safety standards within a medical environment.
And this is where the fraud fighting comes in.
Yes, the key mechanism for rebuilding trust here is the verification of trip logs, using tech, like the Motive AI dashcam, to directly fight fraud. By providing accurate, detailed, and verifiable reporting for every single trip, facilities gain total transparency into their transportation spending.
No more guessing if the bill is accurate.
No more guessing. This clear accountability directly combats the industry's historical issues of misreported trips and billing fraud. It strengthens their relationship not just with the facility, but also with third-party payers like Medicaid. They offer proof of service, not just a promise.
But, operational excellence can't just be an aspiration. It has to be measured.
It has to be.
The business plan outlines some very specific key performance indicators, or KPIs, designed to track this. What are the core metrics they're staking their reputation on with facilities?
They focus on two key metrics that really measure their discipline and their capacity. The first is the on-time pickup and drop-off rate.
Okay, what's the target?
Their target is aggressive: to maintain a 95% or higher on-time performance rate. This is a direct measure of their efficiency and the discipline of their entire logistics system.
And hitting 95% in a place like Orange County with traffic and weather, that's not easy.
It's incredibly difficult. It requires exceptional routing, which is where the Bambi dispatch system comes in, and highly disciplined drivers. But if they can consistently hit that 95% mark, facilities can start to schedule their discharges with near certain confidence. It changes everything for them.
Okay, that's the first KPI. What's the second?
The second tracks their ability to scale that quality. It's the completed patient transports metric.
And what are the numbers there?
They're aiming for modest but very strategic growth. 150 to 200 completed trips per month in their first year, and then scaling that up to over 400 by year 3.
And the purpose of tracking that is to show they can grow without falling apart.
That's it, exactly. They are linking their capacity expansion directly to their efficiency. They're not chasing unsustainable volume. They track this metric to ensure that as they add more vehicles to the fleet, they can still maintain the quality of the service. Specifically, they have to protect that 95% on-time target. If their volume grows, but the reliability dips below 95%, then their entire model fails.
Okay, we've established the value proposition for the massive institutional client. A hospital administrator would be very interested in this. But now, let's shift our focus to the other side of the business. The individual rider.
The private pay client.
The private pay client. The seniors, the families, people who often demand and are certainly willing to pay for a higher, more consistent standard of service than standard NEMT often delivers. What is the promise to this demographic?
The promise to them is defined in the plan as an upscale yet affordable service. For the private pay market, the experience has to feel premium, and crucially, it has to be non-transactional. It needs to feel fundamentally different from being herded onto a hurried medical shuttle.
Yeah.
This is where that core value of dignity really comes into play. They're trying to create an experience that feels more like a premium car service, but one that is tailored specifically for medical needs.
So what goes into creating that upscale experience?
Yeah.
Let's start with the vehicles themselves. What are people actually riding in?
So the initial fleet is centered on vehicles that prioritize comfort, cleanliness, and specialized medical access. They describe them as clean, comfortable, and rigorously maintained ADA-compliant wheelchair-accessible vans.
And the design details.
The core design elements are all about maximizing passenger dignity and safety. So you have high-grade wheelchair restraint systems, proper climate control to keep passengers comfortable no matter the weather, and ergonomic low-floor entry to minimize any physical strain during boarding and exiting.
So it's thoughtfully designed for someone with mobility challenges.
Very much so. The plan also notes that their fleet expansion will specifically cater to more complex needs, like specialized sedans for those who don't need a van, and support for bariatric patients or those who need continuous oxygen support during transport.
And the driver's conduct is obviously key to maintaining that premium, non-transactional feeling.
It's probably the most important part. The driver is the frontline brand representative, so they are uniformed, courteous, and trained in that patient sensitivity we talked about, using appropriate language, assisting with mobility transfers gently, and generally prioritizing the patient's emotional comfort.
So the ride itself should be calm.
The ride is designed to be a calm, quiet, and comfortable experience. The whole professional image is curated to make sure that patients feel respected and valued, because they recognize that needing NEMT often corresponds with a very stressful and vulnerable time in a person's life.
You know, safety isn't just about the vehicle's maintenance. For a family member, a huge part of it is just providing assurance. That AI-enhanced communication system must be huge for calming caregiver anxiety.
It is the single most important factor for building family trust. The mode of AI dashcam reinforces safety by making sure driving habits are professional and consistent, but the transparency that comes from the integrated tech stack is what really sets a caregiver's mind at ease.
How so?
The system provides real-time tracking and automatic notifications to the patient and their designated caregiver. In the traditional NEMT model, you have a caregiver sitting at home, anxiously waiting, wondering if their loved one made it home okay from their appointment. This system ensures they are never in the dark.
That simple reduction of anxiety is a massive value add for a private pay client.
It's invaluable. It's a huge part of the service they're paying for.
So, transparency and safety are the big trust builders, but convenience is also essential for a high-end service. How does SwiftAid make the practical process of booking and paying easy, especially when their clients might range from a tech-savvy adult child to an elderly patient who prefers to use cash?
They've engineered a hybrid, very accessible system to handle this. For the tech-savvy user, there's an effortless online booking system through a user-friendly website. You can quickly schedule trips, manage recurring appointments, and so on.
And payments.
Payment flexibility is key. They offer secure digital payments through an online checkout or on a mobile device. But, and this is crucial, they also cater to the older demographic who might not use apps or who want to use cash.
How do they handle that?
They offer in-person payment options. You can pay with cash or a card through a portable digital kiosk that the driver has, and it provides an instant professional receipt.
So it's a professional transaction no matter how you pay.
Exactly. It ensures a professional, traceable transaction regardless of the client's technical comfort level, which is a major point of respect for the client.
Ultimately, the measure of success for this private pay segment is whether they truly deliver on that promise of dignity. How do they plan to quantify something as subjective as the human element?
They quantify the service quality and dignity using the Customer Satisfaction Score, or CSS.
A satisfaction survey.
A very specific one. This metric is designed to capture feedback on driver professionalism, vehicle comfort, the ease of booking, and the overall passenger experience. And their target is extraordinarily high for any transportation service.
What is it?
They're aiming to maintain a 4.7 plus average satisfaction score on a 5-point scale across all completed trips.
That is a high bar.
It's a very high bar. And this isn't just a survey they look at once a year. It's a constant feedback loop. Hitting 4.7 or higher would be the proof that the operational discipline powered by their technology is actually translating into a compassionate, high-quality, respected experience for the client. It confirms that human-centered care isn't just a marketing phrase.
We have to acknowledge the world this business operates in. I mean, NEMT is incredibly complex.
It really is.
Traffic jams happen. Hospital staff gets delayed on a discharge. Severe weather hits. Perfection is an illusion in this industry. So how does SwiftAid plan to build trust by preparing for and responding to when things inevitably go wrong?
This is maybe the ultimate test of their model, right? Their response to the inevitable exceptions. And their system is engineered for transparency and a rapid, accountable response, not for the illusion of zero issues.
Okay.
So when complexity arises, a major traffic delay, a last-minute patient status change, the technology stack is designed not just to perform the trip, but to document everything. The AI dashcam, the Bambi dispatch logs, they create this immutable, documented trail of what happened.
So documentation is the foundation of their operational honesty and trust.
Precisely. In a field like NEMT, which is highly regulated, has high liability, and is unfortunately high fraud, comprehensive documentation is your shield. This documented trail allows management to proactively review operations immediately when an issue comes up, provide accurate, evidence-based explanations to the facility or the patient.
And it protects them financially.
Critically, it maintains their financial integrity. They have to be able to verify every single trip, every minute of service for those rigorous Medicaid and private pay audits. The technology provides the irrefutable evidence they need to ensure compliance, fight fraud, and protect their reputation against any dispute. They don't hide mistakes, they document them to ensure they can be learned from and accounted for.
Let's circle back to the drivers again, because they're the crucial point of connection and also the source of most potential friction. SwiftAid's business plan emphasizes an employee-first culture as a core operational advantage. How does investing heavily in your employees link back to consistent service quality and accountability for the customer?
The business plan draws a very clear line. Exceptional client care begins with empowered employees.
Which sounds good, but what does it mean in practice?
Well, in the NEMT industry, which is typically a high-stress, low-wage world, employee turnover is usually rampant.
Right, which leads to inexperienced drivers and inconsistency.
All the time. SwiftAid aims to combat this by attracting and retaining skilled, compassionate drivers, and they plan to do that by offering a highly competitive average wage of $24.50 per hour and supporting them with comprehensive HR systems like Gusto for payroll and benefits.
Now, $24.50 is definitely competitive for NEMT,
Mm-hmm.
but maintaining an employee-first culture and high retention, that takes more than just a decent paycheck. How does that investment translate into the reliability that customers expect?
They plan to track the outcome of this investment using another key KPI, the driver retention rate.
Okay, and their target.
Their target is an impressive 85 to 90% annual retention rate. A high retention rate like that translates directly to a seasoned, experienced, and reliable workforce.
So fewer new drivers making rookie mistakes.
Exactly. Drivers who feel valued and are financially secure are less stressed, they're more professional, and they're more focused on the passenger in their vehicle. A calm, supported driver results in a safer, more confident, and non-transactional ride for the passenger. Low turnover means consistent, high-quality patient care and fewer incidents caused by driver inexperience or burnout.
So their investment in staff is a direct, measurable investment in client reliability and trust.
That's how they see it. It's a core part of the model.
Finally, let's look at their financial foresight. We've established that rapid, unstable expansion is the root cause of many existing provider failures. It leads to overbooked vans and missed targets. How does SwiftAid's scaling plan prevent them from falling into that exact same trap?
Their growth plan is meticulously measured and, I would say, conservative. It demonstrates a profound level of operational discipline. The financial forecast details a very strategic, phased expansion.
What does that look like?
One van in 2026, adding a second van in 2027, and a third in 2028. This is not a burst of ambition. It's a controlled, deliberate rollout that is designed to preserve quality over quantity.
And why is that discipline so paramount for the customer and for the facility that's counting on them?
Because it ensures they achieve operational excellence and financial stability before they try to scale their capacity. They're targeting an optimal utilization rate of about 150 to 175 trips per month per van.
So they want to master one van before they add the second.
That's the idea. By demonstrating that the current fleet can maintain that 95% on-time KPI and the 4.7 plus customer satisfaction score at that utilization rate, they prove that their system is robust. They will only expand their capacity when the operational metrics confirm that reliability will not be compromised by overextending the fleet, which is fundamentally the exact industry problem they were founded to solve.
So their financial prudence is a direct guarantee of their operational promise.
It is. It's one and the same.
So this deep dive really shows that SwiftAid Transport is building its entire brand on this fusion of two critical elements. On one hand, you have the deeply human, trauma-informed care that's driven by the founder's social work background.
And on the other, you have the technological discipline, the AI-enhanced transparency, and the disciplined routing that ensures a predictable, reliable service.
The core takeaway for me is that trust in this sector isn't earned by promising some unrealistic ideal of perfection.
No, not at all. Trust is earned by guaranteeing visibility, by ensuring accountability through verifiable data, and by responding with compassionate professionalism when complexity, as it always does, inevitably arises.
Their entire operational design, from the $24.50 an hour driver wage to the Motive AI dashcam logging every single mile, it's all engineered not only to serve the patient with dignity,
but also to protect the healthcare facility's operational flow and ultimately their reputation. They're positioning reliable logistics as a core component of patient care itself.
So what does this all mean for you? We've just analyzed how reliable transportation is this hidden prerequisite for positive health outcomes. If an unreliable logistical link can shatter trust, cause financial fraud, and undermine dignity in our healthcare system, it makes you think about your own professional or personal life. What seemingly mundane logistical element, be it the communication flow in your team, the data integrity in your business, or a simple external service you rely on, is actually a critical foundational pillar of your success or failure. Are those foundational systems built for transparency and accountability? Or are they just chaos waiting to happen?